Hello everyone. Welcome to our channel. Today, we will explore a very interesting and practical topic, especially for those who care about the health of elderly family members. How often should elderly people bathe? This may seem like a simple question, but it holds deeper implications, ranging from cultural habits and personal hygiene beliefs to the latest scientific research. Let's dive into this topic and find the best answer together. Common beliefs about daily bathing. In modern society, daily bathing has become a hygiene standard that most people follow. From a young age, we are taught that showering every day keeps us clean, fresh, and free from bacteria. This habit is deeply ingrained in many cultures worldwide, especially in hot and humid climates like Vietnam. For many, skipping a daily shower may even be considered strange or unhygienic. But is this really true for everyone, especially the elderly? Let's find out. Why daily bathing may not be suitable for the elderly. As we age, our bodies go through many changes, from skin and joints to overall health. These changes make daily bathing, which is normal for younger people, potentially problematic for the elderly. So, what are the specific risks of frequent bathing for older adults? 1. Dry skin. First, let's talk about the skin. As we age, our skin becomes thinner, less elastic, and produces less natural oil. Daily bathing, especially with hot water or harsh soaps, can strip away the skin's protective oil layer. As a result, the skin can become dry, itchy, and even cracked. These cracks are not only uncomfortable but also provide entry points for bacteria, increasing the risk of infections. Additionally, since elderly skin takes longer to heal, this issue becomes even more concerning. 2. Risk of falling. Next, we cannot ignore the risk of falls, one of the biggest health threats to the elderly. Bathrooms are often slippery, with wet floors and limited space. For older individuals with joint problems, poor balance, or weakened muscles, a single misstep can lead to serious accidents. Statistics show that falls are the leading cause of injuries among the elderly, from fractures to head trauma. Reducing the frequency of bathroom visits can also lower the chances of such incidents. 3. Fatigue. Finally, bathing is not just a simple routine for the elderly. For those with arthritis, respiratory issues, or mobility limitations, standing for long periods, scrubbing, or drying off can be physically exhausting. Many elderly people feel drained after bathing, especially if they have to do everything themselves without assistance. This affects their overall well-being and may make them reluctant to bathe frequently. What science says about less frequent bathing? If you still doubt that less frequent bathing could be beneficial for the elderly, let's look at what science has to say. Recent studies have shown that bathing too often may not always be beneficial, particularly for older adults. For example, researchers from the University of Pittsburgh and the University of California found that daily showers can damage the outer layer of elderly skin, making it more prone to tears and irritation. A study published in the New England Journal of Medicine also found that elderly individuals who bathed less frequently had significantly lower rates of skin tears compared to those who maintained a daily bathing routine. Furthermore, both the American Geriatric Society and the American Medical Association have warned that daily bathing not only harms the skin but also poses safety risks, such as falls and excessive fatigue. These findings make us reconsider, is daily bathing really as mandatory as we think? The ideal bathing frequency for the elderly. So the big question remains, how often should elderly people bathe? Experts suggest that the ideal frequency is around 1 to 2 times per week, depending on individual activity levels and health conditions. If an elderly person has low activity levels, lives in a clean environment, and does not sweat much, bathing once a week is sufficient. On the other hand, for those who are more active, live in hot and humid climates, or sweat easily, bathing twice a week or slightly more may be appropriate. The key is to personalize bathing habits based on each individual's needs. There is no universal formula, but the general rule is, bathe enough to stay clean, but not too much to cause harm. How to maintain hygiene without daily bathing. If bathing less frequently, how can elderly individuals still maintain personal hygiene? Don't worry, there are many simple and effective ways to stay clean without stepping into the shower every day. 1. Dry bathing or wiping down. One great solution is dry bathing or using wet towels to wipe the body. A soft cloth with warm water and mild soap can be used to clean key areas like the armpits, groin, and feet. This method not only removes dirt but also helps retain the skin's natural moisture, preventing dryness and cracking. 2. Focus on key areas. Pay extra attention to daily hygiene for areas like the face, hands, and intimate areas. Changing into clean clothes regularly also helps maintain freshness and prevent odors. 3. Moisturizing the skin. To protect aging skin, using moisturizers is essential. A fragrance-free, Alcohol-free cream can help keep the skin soft, reduce itching, and prevent irritation. 4. Ensuring bathroom safety. If an elderly person still needs to bathe, ensure bathroom safety by installing grab bars, anti-slip mats, and having assistance when necessary. This will help minimize the risk of falls and provide peace of mind for the entire family. Conclusion: less frequent bathing does not mean poor hygiene. From our discussion, we can see that daily bathing is not always the best choice for the elderly. Instead, adjusting bathing frequency to fit individual health, activity levels, and personal needs offers more benefits, protecting the skin, reducing fall risks, and maintaining overall well-being. Bathing less often does not mean poor hygiene. Rather, it is a smart way to care for elderly health while ensuring cleanliness and comfort. The key is to strike a balance between cleanliness and safety, allowing elderly individuals to enjoy a healthier and more comfortable life. So, what do you think? Share your thoughts in the comments below. Also, don't forget to like, share, and subscribe to our channel for more informative content. See you in the next video.